Chair now recognizes the gentlelady, Ms. Schakowsky, for 5 minutes.
Thank you, Mr. Chairman. According to a Harvard study, 350,000 people each year prematurely die in the United States of America because of the emissions that we have, fossil fuel emissions. And the study lists Illinois, my state, as one of the states that has the highest impact, the highest number of deaths per capita because of the air quality. And so I'm really engaged personally because of my communities in making sure that we do better. And if you look at what the EU has done, is now moving toward a 5 per, what is it? 5 what is it? What? Micrograms, there it is, I'm sorry. Micrograms per cubic meter standard, 5. And what we're talking about now in the United States of America is we're at 12 right now, and what is being considered is somewhere between 8 and 10, which seems to be very reasonable to me. Now, I want to thank you, Ms. Cooper, for what you're doing with Mom's Clean Air Force, and I appreciate that very much. But also, you have done some focus on what happens to communities of color and low-income communities. And I know we're talking about this debate on whether or not we're going to be hurting jobs in the United States, and that somehow the supply chain isn't going to be there, and the threats that we have. We heard some pretty strong threats about what industry is going to do, and the terrible consequences. But I want to say that there are some real-life consequences as well in lots of communities that also affect the economy. When people, 350,000 perhaps, early deaths, and there are people that are getting sick, and yes, it may have some effect because of the fires that they are seeing, but why wouldn't we also, as industry and as consumers and as people, say we can do better to save lives? What happens in communities then is that the healthcare costs go up, people lose days at work, there's a cost to the economy because of that. And I'm just wondering if we can somehow, in this conversation, balance what we're hearing from industry with what we're also hearing from communities and care a bit more. And so I wanted to ask you, Ms. Cooper, to respond to that kind of balance that I'd like to see.
Well, one of the things I think is important to remember is that the EPA standards are not based on how many areas would already be in attainment. EPA sets its standards following the science and considering public health. There's also plenty of documentation, and I mentioned earlier about the number of deaths every year that are directly related to PM 2.5. I think 100,000 deaths is an unsustainable and unacceptable cost, and we appreciate the fact that the EPA is moving forward to make standards that will continue to protect health and be even stronger.
You know, I just, this idea of gloom and doom that industry cannot accommodate, that jobs, that we're not going to have any construction going on, that they're going to give. I think that pessimistic view of what happens if we make our air cleaner is just overstated, and I just really feel strongly that we have to balance the ability for us to stay healthy, breathing in the atmosphere, and making sure that we have industry able to make sure that our supply chain is working. I think we can do both, and I yield back.
Gentlelady yields back. The chair now recognizes